Viewers, the big story tonight is a story that we were all expecting to break at some point or the other. So there's no reason really to be alarmed. The world is one, it's connected, it's interconnected. It's a village, really, and people move about from one part to another. So it's no surprise that India has detected its first 2 cases of super mutant variant of COVID, which is called Omicron. 2 individuals, one fully vaccinated and the other partially vaccinated, have tested positive. Both are male. One is 46 years old and the other is 66 years old. Only one had traveled to India. The other is a healthcare worker. So viewers, when you're a healthcare worker, you're meeting a lot of other people. Did this healthcare worker get it from another individual? We don't know, because the 2 individuals who tested positive for Omicron are unrelated to each other. These are 2 separate cases. So it stands to reason that Omicron might already be here, and it might have potentially infected some other people also. Hopefully, through testing and tracing, we will be able to identify those other people if they exist. Thankfully, viewers, the good news is that both these individuals, the 46-year-old and the 66-year-old, had only mild symptoms, which is very much in line with what has been the global trend thus far. You've heard from the South African specialist yesterday, Dr. Kwetsi, who was here on Times Now on this show at 8 o'clock, and she told us that some of the patients, as many as 60 patients in South Africa, that she has actually personally been able to assess, have had very mild symptoms. Interestingly, the 66-year-old patient has already returned to Dubai. We are being told that all his 24 primary and 240 secondary contacts have tested negative thus far. The other 46-year-old patient had 13 and 205 primary and secondary contacts respectively, out of which 3 primary and 2 secondary contacts have tested positive. We're still getting details as to whether they have tested positive with Omicron, or is it Delta or another variant yet of COVID. So we don't know. What we do know, viewers, is that one of these individuals was double vaccinated. The other one had only got 1 vaccine, so had been impartially vaccinated. And perhaps that's one of the reasons why they are not severe and they only experienced mild condition. This is conjecture, viewers. This is my presumption. We will, of course, be speaking to specialists in just a short period of time. We will be speaking to Salim S. Abdul Karim, Director of the CAP-RISA and Vice President of Outreach and Engagement at the International Science Council. He is the head of the entire operation in South Africa that helped identify Omicron. We'll also be speaking in just a few moments with Professor Suresh Kuchipudi, virology, head of virology of the Pennsylvania State University, Dr. Rahul Pandit, member of the Supreme Court assigned COVID Task Force and member of the Maharashtra government COVID Task Force. So another individual who is a top-notch expert. And Dr. Ashok Seth needs no introduction, chairman of Fortis Escorts Heart Institute, has been a regular on Times Now for the last year or so. Now, viewers, we all know that India has really been very vigilant and has mounted a rearguard action of sorts. Several curbs on international travel and travelers have been put in place. International returnees are expected to undergo, especially they come from those countries that are on the blacklist or on the alert list, viewers. Those countries, they need to obviously test themselves as they land in India. A variety of tests are now available at the airport, RT-PCR tests, and also, of course, the quicker test that is undertaken here in India, which is a test that looks very, very closely at antigens, the antigen test, the rapid antigen test, and it's conducted and you get a report within a few hours of being tested. It's a slightly more expensive test, but it is being widely undertaken by those that are returning to India. Viewers, we do know that all international returnees, they have to take this RT-PCR test, submit a report, 14 days of travel details. If they are coming in from countries of concern, then of course they have to undergo mandatory COVID test on arrival in India, 14-day home quarantine, even if tested negative. There is talk that that particular advisory might be changed, that they might even be institutionalized quarantine and government expense. So we will be looking at those closely over the next few days. If you're flying internationally, scheduling reopening from December 15th has been postponed, as you know. So if you have travel plans, you might have to recheck them. Also, at-risk nations, Europe and 11 countries tagged for detection at the level as of now. And that's really what we know. That list could, of course, increase. Remember, viewers, Omicron has now been detected in 29 countries. That is what the government told us in its press conference today. Passengers are also to upload negative RT-PCR reports when they fly into India. So before flying in, flyers must fill the self-declaration form, and flyers must give 14 days travel details again. And at risk, as I've told you, viewers, a series of measures have been already put in place. Some of them caused a bit of confusion and chaos at the airport yesterday. I'm told the situation slightly better today. Obviously, teething problems are being resolved even as we speak. Now, let me very quickly, viewers, begin by inviting you, all of you viewers, to dial in and speak to the experts. You're going to see the number being flashed at the bottom of your screens, on the grid as we call it. Nizam Bhai will put it out there, and you will find that you can easily access us by calling on that number 0120-6634691/692. Call in. We'll take your calls. These are live calls, viewers. So you will be immediately patched through to our experts. Obviously, you will have questions, and these questions about what you can do to protect yourself will be answered by our specialists here. There are 6 basic questions that come to mind, and let's go one by one and let's open this conversation up. Why is Omicron virus so infectious? This is the most basic question that each one of us is asking. Is it fundamentally more virulent than Delta? And what makes it so? So let me open that question out. As I said, we have a whole panel here of experts. You can speak to each one of them. Professor Suresh Kuchipudi, Head of Virology of Pennsylvania State University, also here with us. Dr. Rahul Pandit, member of the SC assigned task force and member Maharashtra government COVID task force. Dr. Pandit, what do you make of the first question? Why is Omicron virus so infectious? What are its basic qualities, etc.?
Good evening. I think there are 2 causes for being very, very concerned about it. The first one being that the predominant strain in the whole world was Delta. And if we look at the current state of infections happening in South Africa, majority of the Delta has been replaced by the new variant, which is the Omicron. So I think we had a Delta variant which was so robust that it wouldn't allow any other variant to stand in front of it. And we've got this wiped out within the span of 7 to 10 days. The second is, of course, the mutations. And the mutations which have specifically happened around the receptor binding site, or the spike protein, what we would commonly call in common people's language, which is the one which attaches itself to the cells to actually cause the infection and the penetration into the human body. And if those have mutated to us, or almost more than 32 mutations have been detected there. So that's what makes it more likely to be highly infectious, as well as concerning. Whether it is more virulent or not, and what are the other implications of that, I think that needs to be seen. But these are the 2 things which are concerning right now. It has completely replaced Delta, and it has got spike protein mutations which are of a concern.
Okay, let me go straight across to Salim S. Abdul Karim, Director of Caprisa. Your country, sir, of course, detected Omicron and has unfortunately paid a price for it because most people have suspended flights to South Africa. Perhaps knee-jerk reaction there, but nonetheless, you did isolate, identify it. Now, how are Delta and Omicron variants different? And let me ask you the same question I asked of Mr. Pandit. Why is the latter more intensive and more transmittable? Mr. Karim.
Good day. Well, when we look at the new variant, Omicron, what we are seeing is that it has mutations that are also present in all four of the previous variants of concern. So it has mutations that are in the alpha, beta, gamma, and delta variant. As far as delta is concerned, this particular new variant, Omicron, has many of the mutations that enable delta variant to transmit faster. So we are anticipating, based on what we're seeing, because we don't know yet for sure, it's too early, that this Omicron variant is going to be highly transmissible, probably more so than Delta,
right,
though that needs to be confirmed.
Okay, so we're going to have, there's a debate raging already between our two experts, whether it is replacing Delta or it is going to, or we need more science to determine that. But nonetheless, early days, viewers, no need to panic. As we've been saying to you, if you follow the procedures, you'll be okay. We're getting a large number of our viewers calling in. Times Now viewers are calling in. Srinivas calling in from Bengaluru. Srinivas, go ahead with your question.
Yeah, good evening to the doctors on the panel and Rahul.
Good evening, sir.
So, I would like to ask the esteemed panel if a booster dose will now become inevitable given the situation. And secondly, can a person who has taken 2 shots of Covaxin take a Covishield booster and vice versa? So,
if you can mix vaccines. Very good questions. I'll open them up. Also, let's take some other viewers. Subramaniam also calling in from Bengaluru. Mr. Subramaniam, go ahead, sir.
Hi, Rahul. Good evening.
Good evening, sir.
My question is that, speaking of myself, I have been double vaccinated under the comorbid category, both doses of Covishield. In the month of June, I had an attack of COVID. Fortunately, I got off quite mild. Okay, maybe the vaccination saved me. Now, what are my chances of getting a reinfection with Omicron coming in, and what precautions should I take given the fact that I am comorbid?
Very good questions. Let's get in Dr. Ashok Seth on these questions. So, Mr. Subramaniam asked, is a booster now inevitable? And can we mix vaccines? Mr. Subramaniam said, I'm double vaxxed, comorbid, got COVID somewhere in June. What are the chances of reinfection? And what am I supposed to do?
So I'm going to address each one very specifically. Let's first take it for granted that, and the focus is let's double vaccinate the country.
Okay.
And still we have 55% of the people not double vaccinated. We need to be fair to everybody. But having said that, I would actually say to the person who asked this question about booster that this is the time for the country to consider a roadmap for booster, just like they've done for perhaps for vaccination, because booster is going to become important. There's no question.
Yes.
It's been important for every vaccination that we've known. It's only the time period that we're uncertain about. When should booster be given? And because we've not known that and we haven't felt the need for it till now, we've actually concentrated and focused on the double vaccination. Yes, the government is already thinking about the boosters. The discussion is not for and against. We are not taking sides on for and against.
Sure.
It is only the matter of what is the right timing for it, and perhaps if with the variants around the corner, and if we have surplus vaccine, anything about their wastage, then yes, a booster would be considered for everyone. That's the first point.
Yes.
The second point is mixing. And by the way, there's been good data, especially done in Spain, especially in England, where, as you know, first Covishield was given to a lot of people. It was AstraZeneca vaccine. And then because of certain clots, etc., actually the second dose or the third dose and a booster dose has been tested with Pfizer. And it's been shown that mixing vaccines can generate a better immunity than the same series of vaccines.
Right.
The virologists would tell you that. But actually, firstly, let me just say, that's a theoretical possibility for us in the country at the moment. India is doing its own studies.
Okay.
Till the experts tell you to get a booster, and then also whether mix and matching is possible.
Yes. Let's be very clear, viewers. Don't go out there and mix and max as you want. It's not permitted right now under Indian law. So please don't do it.
Experts will guide you when that has to be done, and that's being looked at in trials in India.
What about getting it again? The person who called double vaxxed, Mr. Subramanian said double vaxxed, got an attack in June, mild. Maybe the vaccine saved him?
Yeah, absolutely.
Is there a danger of reinfection?
So we must understand that this panic which is about Omicron should not be there.
Okay.
Vaccinations protect from serious infections. Until now, what we're seeing is mild infections from Omicron. But specific to your answer is the fact that you actually are in a situation where you were double vaccinated and had mild illness, probably because of the double vaccination. However, having had another attack of COVID, you perhaps have the best antibodies and you perhaps have the best immunity that can be achieved. Probably that third infection acted as a booster for you. So you have least amount of worries for the moment. I don't think you should be scared.
So basically follow masking, social distance, basic protocols. Okay, let's get more viewers in. Many viewers are calling in and I need to go very quickly between them. So let's keep our answers also short and sharp so that we can accommodate many questions. Harry calling in from Bengaluru, Vineet from Jaipur. Harry, good evening. Go ahead first.
Good evening, Rahul.
Good evening, sir.
My question is this. We have double vaccinated people and single vaccinated people who have been infected. So all this talk about the booster dose, how effective is it going to be when you're having an attack even after the second dose?
Very good question. Do we need to reconfigure the boosters? How effective will those boosters be? I'll come out to that. Let's take some more. Vineet calling in from Jaipur, another Times Now viewer. Vineet, go ahead with your question, sir. Good evening.
Both the shots have done. So how safe we should feel and how safe our baby, like, does she have antibodies kind of?
Okay, so we'll come back to that. How many antibodies? How do we know? We've had both doses. Okay, Siddharth calling in from Bengaluru. Many Bengalurians calling in tonight. It's always a good sign. Love to hear from other capital cities also, Chennai, Delhi. Let's hear from them. Go ahead, Siddharth. Good evening.
The doctors were there. So both the cases are reported from Karnataka. If I remember and recall that the first COVID cases also in the year 2020 got reported from Karnataka only. Having said that, the one person who traveled from South Africa to India tested negative on 7th day and flew back to Dubai.
Yes.
So I am unable to understand the behavior of this virus. How this Omicron, because right now we don't have any such data that whether this will be a fatal in future or not. So can any of the doctor can throw a picture on this? Thank you, Mr. Shivshankar.
You're most welcome, sir. Thank you for calling in. Also, let me go across to Kush Bhargava. Mr. Bhargava, go ahead. I think you're also calling in from Bengaluru.
Yeah. See, my first part you have already answered on the reinfection. The second part is it likely to be airborne for a longer time? So even if you are wearing a mask, you are at home, you may still get infected?
Okay, very good questions. Is it likely to be airborne longer? Professor Kuchipudi, would you like to take that question? Also, a booster, does a booster need to be now reconfigured? We are obviously taken vaccines based on the earlier formulations of COVID-19. Will we also need to now upgrade the boosters? What about antibodies? 2 shots. How long does antibody protection last? And why did somebody turn negative in 7 days? Usually it takes 14. That's what we are told. So how does this work and why is this so confusing? All these questions out to you. Mr. Kuchipudi.
Yeah, so good evening, Rahul. Thanks for having me and good evening to your viewers.
You're welcome.
Lots of questions. So I just want to address a couple of fundamental points that we need to remember. When we talk about vaccines, the 2-dose vaccine regime, which is clinically approved, basically is meant to protect you from serious clinical illness or hospitalization, as Dr. Seth has mentioned.
Yes.
So it doesn't mean that it completely protects you from infection. So you could be vaccinated or you may be infected, but the key aspect is that the protection is against severe disease. So vaccination will protect you from severe disease, but you could have a mild or transient infection. So you could, and that is not necessarily a failure of the vaccine. So I want the viewers to be clear about that. And second thing is how long the immunity lasts. And the question basically depends on a number of different factors. So your age, genetic factors, but more importantly, the type of vaccine you took and the duration of the vaccination. So with regards to the booster, I think certainly there is now extensive evidence to suggest that the booster would be a very good thing to enhance your immune response.
Right.
But as Dr. Seth said earlier, these are the decisions that have to be made in each country based on the resources and the need and the availability of the vaccine.
Dr. Pandit, have we left this decision a bit too late? If you want to actually build a booster that gives you protection against other forms of COVID, maybe we should have started that research about 3 or 4 months ago so that we can have a booster ready in the next 1 or 2 months. I'm being told that certain countries are already looking at boosters which are enhanced. Very quickly, Dr. Pandit.
So the research has already started 3 or 4 months ago. We should be getting the results analyzed and basically study about the schedule of the vaccination for booster. We need to differentiate here between an additional dose and a booster dose, please. The additional dose will be required for people who are immunocompromised and who have not mounted an immune response to the first 2 doses. They would need an additional dose. And for people who have already received 2 doses and who are immunocompetent, they would need a booster dose.
Right.
And the third thing was the gentleman who called up and said he's already had COVID, which I think Dr. Seth has already addressed that. The COVID plus 2 doses, maybe it actually is acting like a booster already. So maybe that subgroup may be left off for a booster dose to be given later on. The other categories may have to be given the booster before.
And why are we suddenly seeing a 7-day negative? How does that happen within 7 days?
So it all depends on, so first of all, there's a 30% chance for any RT-PCR test that could be actually false negative. That's the first thing which I would like to say. The second thing is that it would also depend on the viral load. We are assuming that the day when this gentleman was tested, it was day 1 for him, but it may have been day 10 for him, that when we tested him actually. He might have been positive, carrying the virus for last 7-8 days.
But then
wouldn't
it have been, sir, filtered out because you are supposed to take a test before you land in India, the 72-hour test?
I agree. There are too many coincidences there, but these are all possibilities which are true and they can happen. So it's unlikely that
you could have had one negative, and then, you know, the person was actually somebody who was carrying it and tested positive finally in India, and then, well, he was already into his 7th day. Okay, maybe that's something. Also, sir, is it likely to be airborne more, longer, etc.? And that question maybe I can ask of Mr. Karim there. Do you think this is going to be able to sort of surpass vaccinations and even escape the RT-PCR and be more virulent?
When we look at the mutations, many of the immune escape mutations that we see in the beta and gamma variants are also present in Omicron. And when we look at the Omicron mutations, there's a high likelihood that it will be able to evade at least some of the antibodies. It is quite likely that it is going to cause reinfections. And the reason we think that it will do so is that the beta variant caused infections in people with past infection at the same rate as people who did not have past infection. So we know that based on those mutations, we are likely to see reinfection in people who were infected naturally previously. As far as vaccine immunity is concerned, it's a little bit more difficult to tell. We may see some partial escape, but it's unclear as to whether it would be more than just partial.
Okay.
But the one thing, and that's some source of solace, in that what we have seen is that most of the vaccines have done quite well in preventing serious illness and death. So hospitalization, serious disease, and death, all three of them, we have done quite well with the vaccines in preventing that. And given that the vaccines have been able to prevent severe disease from all the previous variants of concern, we can only hope that that will also apply to Omicron. And there's good reason to believe that it will.
Well, that's wonderful news and something that we must savor here. That's studied research, and you're hearing it from one of the global experts on this particular variant. Now, we have 4 viewers joining us tomorrow. Also, viewers in Parliament, a discussion on Omicron. Big questions need to be asked. We'll, of course, be covering that live for you. Muhammad Jamil calling in, Bala Subramaniam, Raj Kumari, and Padmaja. I'll come to each one of our viewers, our precious viewers, one by one. Mr. Bala Subramaniam, thank you for holding on. You're calling in from Bengaluru. I think we lost him. We'll try reconnecting. Muhammad Jamil from Dumka. Thank you, sir, for calling in and speaking to us. What's your question, sir?
My question is that our Prime Minister Modi has celebrated maximum number of Indian people have taken vaccinated, and after that, once more the panic has been all over India, and the foreign air buses must be restricted before 15 December.
Okay, so are you saying, sir, that you're asking the question, should we be tightening restrictions on air travel? That's your question, right?
Air travel must be restricted.
Okay. We'll come out to one of our experts and find out if that'll make a monumental difference. I'll come out to that. Raj Kumari also calling in from Mumbai. Go ahead, Miss. Miss Raj Kumari, are you there with us? We just lost her. Padmaja calling in from Pune. Miss Padmaja, go ahead, please.
Yes, I have a question. Is this particular mutant is more severe than our COVID-19?
Okay.
And what is the treatment for it?
What's the treatment for it? Okay, well, very interesting. Dr. Seth, I think we've looked at the fact that it is more transmissible, but is it causing more severe damage to patients, number one? And number two, what's the treatment?
So firstly, let me just say that there's no cause for panic. Unfortunately, Omicron's become a dreaded beast even before we understand it well. More information is going to come in time. So all we know at the moment, this is in response to your question, is that yes, it is probably more transmissible. But what we don't know is, does it cause severe illnesses? The answer is we don't know yet, but it does not appear to cause severe illnesses, as from the first-hand information from the experts who are in South Africa, who've actually seen the patients in large numbers there. Finally, does it evade the immunity? Does it evade vaccination? It probably could, but again, that's an answer we can't give at the moment, and we will know that in the next 2 to 3 weeks. So in an answer to you, just relax. Be cautious.
Treatment.
Be cautious.
Treatment.
Be cautious. Oh, and treatment.
Yeah, lot of things that were tried apparently during the second wave turned out not to be effective. Correct. We all thought they were, but they weren't. That's what we were told. I don't know how that sort of squares up. Yes.
It appears, and we would only say it appears, that at the present moment, its treatment is not going to be any different from what we've known previously. We still don't know whether it's going to be a severe illness leading to hospital admissions. That's not happening in South Africa in huge numbers at the moment. But again, time will tell us that. So at the moment, its treatment is going to be similar to what we've known for coronavirus.
A lot of drugs that were taken, remdesivir, for example, tocilizumab, a lot of steroidal-based applications, they've all now sort of been rejected.
That's right. So we're going to say that that is what the standard of treatment is now. That you're right, those have been rejected. Those actually did not prove their usefulness. The only thing which proved its usefulness was low-dose steroids, and that also in situations where hospital admission was required with low oxygenation. So short of that, we don't have any other drug. And in fact, the best drug is actually at the moment, best vaccination is taking all the precautions. So we must remember that when I say standard of care, I actually mean the very fact that remdesivir is out, tocilizumab is out, plasma is out, and the only drug with us available, which is of proven benefit, is low-dose steroids early on in the illness when the patient is going to be admitted to the hospital. Okay. Yes, we've got monoclonal antibodies.
Dr. Pandit, monoclonal treatments. What about monoclonal treatments, Dr. Pandit? That was the rage. Many people have said that, there are those which help. Now, can you illuminate?
So theoretical possibility that the mutations which have happened at the spike protein, that's where the monoclonal antibody is supposed to act as well. Right. So there's a theoretical possibility that there may be some escape from the monoclonal antibody as well. But in COVID-19, it's a unpredictably predictable virus. Whatever comes into theory does not probably translate into practice. So we have to just wait and watch. Okay. Perhaps we may be too early in calling it. So I think we need to give time, Rahul, maybe 2 or 3 weeks. One timetable of COVID needs to get over at least before we can make any further comment on this.
I think you're very right. Viewers, just take a deep breath. Follow the important guidelines for appropriate behavior. That is fundamental. Get yourself vaccinated even if you haven't. Make sure you complete the vaccination cycle. If you're still dithering, go out there, because there is evidence now. And there are these 2 cases. Both people, one double vaccinated, one single vaccinated, showed mild symptoms. So maybe there's a correlation there. Please go out, viewers. Go out there, get your inoculations done, complete the cycle. That's very important. Mask up, stay socially distanced. Don't go into too many crowded places. Even in office, be a little careful. Make sure you're sitting at a distance, not crowding around water coolers and in lavatories. Be careful. Let's open this up further. Ashish Jha calling in from Mumbai and S. Ganeshan from Delhi. Mr. Jha, go ahead. Good evening.
Good evening, Mr. Shankar.
Good evening, sir.
My question is, since a lot of permutations and combinations is happening with these virus mutations and all, do you don't develop one proper mechanism to analyze what mutations will come next?
Okay. Well, I'll get Dr. Pandit or Dr. Professor Kuchipudi to respond to that. That's an interesting question. I suppose whoever has the answer will be winning the Nobel Prize next time for medicine. But let me bring in S. Ganeshan from Delhi. Mr. Ganeshan, go ahead with your question. Good evening.
Yeah, good evening, Mr. Shivshankar.
Good evening, sir.
Yeah, my question is that the second wave, the Delta wave, that lungs are affected very badly and that oxygen level dropped very drastically. So those who are recovered from that Delta variant and having diabetes and other complications, what is the precaution they have to take from the beginning?
Right.
Because it's a kind of panic situation.
True. No, don't panic, sir. Don't panic, Mr. Ganeshan. One of our doctors did answer that question, saying that, look, if you've had a relapse, that is after you were vaccinated, you were infected again, then you're probably enjoying a booster by default. So you already have very high levels of antibodies. You don't have anything to worry about. Just be relaxed. Mr. Ashish Jha had posed a question about why aren't we able to predict very quickly the next mutation? Professor Kuchipudi, would you like to take that question? Also, Dr. Sanjay calling in from Ranchi. Dr. Sanjay, very quickly with your question, please.
Okay.
Yes, sir. Just lower your volume. Go ahead. Yeah.
I have 2 questions.
Yes, sir.
One is, as Dr. Seth said, as Dr. Ashok said,
yeah,
that low-dose steroid is a treatment for maybe like Delta variant, this Omicron variant. I want to just, an inquisitive question, that black fungus was caused by excessive use of steroids during Delta variant, second wave. So is it not, will it not be a little, what I call, apprehension that there will be more black fungus cases if we randomly use the steroid? This was my first question.
Okay.
The second question would be that if the doctor said that mixing of vaccination will definitely help. So why not we all consider mixing the vaccine, making the cocktail, and give it as a third dose?
Okay, let's first of all, viewers, I don't think anyone is advocating anything to be done at home or without government advice. So that's very, very important. There is anecdotal evidence that suggests you can mix vaccines. Which vaccines, of course, remains a big question. We have seen that it can happen in foreign countries, but in India we have Covaxin and Covishield. Can they be mixed? We don't know. I don't personally know the government having come out and made any such declaration. So that's very important. So right now that question is pretty much off the table. This is to do with the international experience where people have mixed vaccines. But in India right now, there is no evidence to suggest that that can be done. And I don't think we want to encourage that at all. So that question parked aside. Black fungus, big concern, Doctor. Very quickly, Dr. Seth. And of course, Professor Kuchipudi on the first one about why can't we predict the next variant. So maybe Professor Kuchipudi, you can go first. Yeah.
Right. Yeah, sure. So Rahul, that's a very interesting question. And I wish I have an answer. So I think the fundamental thing that people need to recognize is that the viruses, as they replicate, they make these random mutations, which are mistakes during the replication, which is completely random. And there is no way anyone can predict. But what happens is that some of these random mutations at some point gives the virus an advantage to become better at transmissibility, as we saw now. And as by very nature of these processes being random, there is absolutely no way we can predict. And let me also say this, which also means that now we have a moving target. The virus is changing in ways that we cannot predict. Therefore, we cannot also preemptively make a vaccine for a target that is constantly moving. Therefore, we could think about developing universal or cross-reactive vaccines, but preparing a vaccine ahead of the time for a variant that we do not know yet emerged is practically impossible.
Practically impossible. Okay. Dr. Seth, on the black fungus.
I think he raised an important point, and I would love to address that for him. He's right. Random use of steroids has been very harmful. I would just guide you that it is low-dose steroids for a period of 7 to 10 days, which does not cause any harm. High use of steroids is unproven, and prolonged use of steroids is what gives rise to super-added infections, including black fungus.
Okay, very interesting. I just want to bring in, again, Mr. Karim, for the fourth time. Let me just bring him in. Dr. Karim, do you believe that the global reaction has been proportionate to the severity of this strain, Dr. Karim, or has it been an overreaction and people are just unnecessarily, panicking?
It has been deeply disappointing and frankly quite outrageous to see the way in which South Africa and Southern Africa has been punished for our announcement. It has sent a very clear signal to any country in the future. If you did discover a new variant, hide it, because that's what is being said. If you are open and transparent in the way we were here in South Africa, be ready to take the economic consequences of that. They will shut your borders. They will build a fence around you to avoid having anything to do with you. That is a very sad indictment of our world. It's an overreaction. We have dealt with variants before, and we're going to be dealing with variants again. We have to be able to deal with them, and we know how to reduce the risk of spreading the virus through international travel, whether it's by air or by sea. So using just simple prevention measures, we could lead to a situation where this virus would spread much more slowly. Okay. The reality is it is going to spread. It is going to reach almost every country. That is not something we can avoid. It is in the nature of a highly transmissible virus that spreads even before it is clinically apparent. So by the time it becomes clinically evident, it's already spread. So that's how we have to deal with it.
Okay, so I have two questions, Dr. Pandit, for you. First, and these are basic questions. I just want to ask you, if this is such a easily transmittable virus, do we need to once again think about, lockdowns, this, that, the other, to cut transmission rates? And if that is the recourse, then vaccines, where do they fit in with the response?
So I'm very clear, lockdown is not going to be an answer for any of our problems which we are going to face from here on. I think we need to be very clear that the best solution for us today is to double mask when we step out of the house, and for all frontline workers, N95 mask. And vaccines are the second most important. I mean, parallelly, I would not grade one over the other, but parallelly, as important as masking is vaccine to be taken. And vaccine manufacturers will, and the scientists will tweak those vaccines as we go forward for the different strains. We just have to wait for that to happen. I mean, it's happened for H1N1, but H1N1 was discovered in 2009. Right. And in 2021, we can say that every year we get a new vaccine for the particular strain for every year. Right. So it will happen. We've got to just give the time for the science to evolve. We already know that it will happen. Just have to wait patiently for it. But both the things are important. They are like a parallel wheel. We have to use both of them together.
So double mask. If you are a health worker, N95 mask, definitely get vaccinated. Last question to you, Dr. Pandit, and this is a question that we have touched upon about boosters, especially modified, upgraded boosters. How soon should we be bringing them into play? How soon?
So I think the first is that we need to have a booster policy out. That's the first thing to do. And as soon as the booster policy is out, the vaccine manufacturers would, I'm sure, be working overtime to try and get a second generation vaccine, or second generation booster is what I would say, to get to the people so that we have a more effective
so what is the time frame, ideal time frame? If we all need, and I interviewed Dr. Ella, who manufactured Covaxin, and he said that, look, after 6 months, we see an appreciable drop in immunity cover from Covaxin. Now, a lot of people got their Covaxin shots, somewhere in March, April. So they might be at the expiry of their immunity cover. So how quickly should the government, should it be announcing a booster policy in the next few weeks, days? What do we do?
I think that's been already discussed, and it is something which is on the cards. Okay. Which category of people or population would benefit is something which we need to wait and watch. They would probably go into a graded fashion in which the population which probably has got no immunity or very low immunity right now would get the first dose. Right. And then, of course, maybe the elderly and the healthcare workers who are the frontline workers would get that.
Well, of course, that will also be assessed, because if Omicron overtakes, becomes big again, then we might be under time pressure dictated really by a variant, not by the luxury of a rollout that we would have taken our time in deciding. So viewers, this is again a catch-22 situation building, but as all the doctors have said, no need to panic. As of now, the symptoms are mild, especially in those that are vaccinated. Keep that in mind. Get yourself jabbed, wear your mask, double masking, take all precautions. I'll take a short break. We're right back, viewers.